also the Executive Director of the Dagama Foundation and a Strategic Change Management Consultant. He's also a member of several boards, including MTN Nigeria, Seplat Petroleum Development Company PLC. She's an independent director of Nigeria Breweries PLC, Executive Director, Mrs. Feko, for the welcome notes.
We can hear you, Mrs. Okaru. Please go ahead.
Hello. I hope you can hear me. I really wish I was in a better place to be able to be part of this webinar, having the panelists and the participants on the elderly. As I speak, I have a team, and I'm on my way to begin now to meet my father well. One of the challenges of COVID, the reception is going to be poor, so I wouldn't take too much of your time, but just to say thank you so much for being part of what we've always wanted to do, which is to build awareness around the elderly, and we really appreciate the work of the panelists in taking and guiding us on how to do that during this period. Thank you and have a great day. Thank you.
It's Alera Roberts. She's a successful medical practitioner at the University of Lagos, and it thoughts most of us have seen our face before of thoughts on COVID-19, on how the Nigerian government can help combat this burden of COVID-19. So I want us to appreciate her as I welcome her once again. Welcome her.
Thank you very much, and it's very good to be here. Do I have permission to share my screen?
Yes, ma'am.
So we will look very quickly at the health impacts of COVID-19 on Nigerians, particularly on the elderly. Like most African countries, this slide just gives us a quick overview of what the situation of the elderly is as far as the WHO is concerned. In Nigerians, people over the age of 60, myself included, are classified as elderly. They face heightened challenges of access to health and social care. They are vulnerable to economic challenges, and this is the estimated elderly population that we have in Nigeria at present. Where COVID is concerned, we're looking at a situation in Africa where it appears as if we've got a very soft landfall. As of June 15, 2020, 54 countries had been affected, 114,212 recoveries. And you can see from the map infographic that I'm showing that the highest number of cases are in Northern Africa and South Africa. And Nigeria seems to have gotten away with less than, we're certainly still under 20,000 cases as at now. And when you look at the scenario, now, this slide gives us the quick scenarios of transmission where any epidemic is concerned. Scenario one, countries with no cases, which is where we were before the Italian man came in. However, that does not mean that there were absolutely no cases. It just meant that we had not identified any cases. Scenario two, where there are one or more cases either imported or locally acquired, and these are sporadic cases. This is the case where we were when we identified a case in the Italian man and in the people he had immediately come into contact with, and the attempt was made to contain the spread at that point. Coincidentally, we contained that spread. Every person he came into contact with, we identified, isolated, and that spread was contained. What we did not contain were the numerous other cases that came in undetected at about the time that he came in. Many of whom could have come in even before he came in. And maybe they got ill or their symptoms were so mild, they didn't report to hospital, they just stayed at home, recovered and died, and their death was attributed to something else. So we moved into phase 3, which is where we are now, where we are experiencing cases as clusters in time, in geographic location, and common exposure, which is what we're seeing now. So we're seeing cases all over the country, all over the state, certainly. And this is where we are, what we call community transmission. In Lagos State, these are the confirmed cases that we've had since the 17th of March. And you will see that these two dips in the numbers are not that the numbers went down. It's because there was a lack of extraction kits to test the samples that were collected. So they're what we call spurious dips. But definitely, we still had an overwhelming number of daily cases that we're picking up every day. When you're talking about the disease COVID-19, the course of the disease can run from about 15 days after a short incubation period for a mild case to many weeks, up to 10 weeks, where there's been a long incubation period or where the worst case outcome. Many of these cases that last weeks into months are cases that have had to end up on supportive oxygen therapy and even ventilator care. So for most and generally for most people, we have this blue situation where you have 1 week of mild illness. Some may not even have any symptoms at all. If we could do widespread testing and we tested them, they would test positive, but honestly, they would not feel anything at all, not even a hiccup, not even a mild, nothing at all. Then we have, and this occurs in up to 80% of infections that we see. Then we have people coming into mild disease, where they have a fever, a headache, a cough, and loss of smell, loss of taste, loss of appetite, a general feeling of unwellness. And it may clear in anything from 2 to 3 days. Many of our younger doctors who got it, it was afterwards they realized that that thing I had last week that felt like malaria must have been COVID, but they're now fully recovered. A few, however, become severe, and these are the ones where we have problems, and the biggest problem we have is the respiratory distress. These are the ones who need uh, oxygen therapy, and it may even need to go on a ventilator. These are the bad ones. Now, what makes a person stay in the blue zone? What makes a person just mildly dip into the light yellow zone? And what makes a person go to the deep orange zone? That is where we have the problem. We know that the elderly, those with comorbidities, those with immune suppressive diseases, tend to be more at risk. But we have seen so many wonderful things during this period of COVID. How are the elderly affected? There's a direct impact and there's an indirect impact. The direct impact is that we are unable to prevent them from getting exposed to the virus. We're at a stage where I keep telling people very sadly, everybody is going to have to come in contact with the virus, whether by direct exposure or by vaccination. Of course, there's no vaccine yet, so we're left with the first option. And we are unable to prevent many of the elderly from being exposed to the virus. Of course, being elderly also presupposes that they are more likely to have other comorbidities, diabetes, cardiovascular disease, chronic obstructive lung disease. They are more likely to, they will have a weakened immune status. That is for sure and for a fact. As you advance in years, your immune status is going to weaken. To the extent to which it will weaken, however, is what we have some control over, what we hopefully are talking about. And then, of course, they are more likely to have a higher incidence of mental health issues, depression, delirium, sepsis. The elderly are very, very prone to sepsis, and sepsis is a generalized infection of the body, and it may not even manifest with a fever or any localizing symptoms. So it's something we have to keep uppermost in our mind where the elderly are concerned, and we notice even a change in behavior. We are thinking delirium or sepsis. Now, where the deaths are concerned, they are not just numbers. So when you see things like China had a case fatality rate in the adults of 60, adults aged in their 60s of 3.6, which increased to 8% in adults aged in their 70s, which increased to 14.8% in adults aged in their 80s. Every death is a person, has a name, has a family, loved ones, has a role to play in society. And these are the things that we often forget when we are looking at data. Sweden had a case fatality rate of 90% of deaths in people aged in their 70s. Data from South Africa and Nigeria is growing by the day. But the important thing to remember is that loved ones are loved ones. Now, while we may not have care homes or residential facilities, we have issues with the elderly in our homes. Number one, like I said, almost 80% of cases are completely asymptomatic. That is that when you look at this picture of a multi-generational family unit, you see all these lovely young children and their bright smiles and bright eyes and bright ears. They can be carrying the virus. In fact, most and generally they are. And they are what we call the super spreaders. And they can bring it back from home, from school. They went to play with their friends in the street, play football, run around, and they're bringing it back to the vulnerable older folk at home. The other thing we have to remember is that the older folk are often less able to access health care. Financially, they may be less able to pay for health care, they are less able to move around and access health care. The indirect impact is more, how would I put it? It's actually more devastating. For instance, among the old folk around me and a lot of others, there's the loss of comforts and support, closure of places of social gathering, shielding where the younger family members are unable to visit. My grandson hasn't come to see me now in weeks and weeks and weeks. It's very painful. Then we have the social isolation. Many of the older folk are not as digi-savvy as the younger ones, and therefore they are less able to do the Zooms and WhatsApp and the FaceTime that will put them in position, that will keep them in a social contact with their family members and friends. They also have reduced access to regular health services. And then there's this issue of what we call systemic ageism, the assumption that older folk have limited or no value to society. So when we're in a country such as ours with limited health resources, the tendency or the assumption or the temptation is to reserve those health resources for those who are perceived to have value to society. Systemic ageism. Luckily, we don't see a lot of it in this country. I'm very, very grateful to say that. But I know it is something that has cost them a lot. In the UK, particularly, that they talk about, where they quarrel that the older folk are blocking beds in the NHS. So how do we plan to help? It's important that we identify those at risk. Elderly, 60 years and above, people with comorbidities, family. It's important that we identify resources. This is the time when I've been asking everybody, who is your primary care provider? Put them on fast dial on your phone. Which hospital are you registered with? Why can we take you in a hurry? Or call, even if somebody are going to send somebody out. Who can take health decisions on your behalf? Who is around that you can give proxy permission to take health decisions on your behalf? Who will pay? Where are the funds? Do you have insurance? Then we have to be more proactive about the non-pharmaceutical interventions and encourage a lot of exposure to sunshine. The issue of sunshine and vitamin D it's still out there, but there is a clear synergy between those who have exposure to a lot of sunshine, those whose vitamin D levels are very high, and those who don't develop severe COVID. It's very fascinating to know that in the very famous First Cardiology Hospital, Dr. Johnson will tell you that all his patients of 90 and above walked out of the hospital. They got better and they walked out on their own 2 feet. And this has something to do with their sunshine, with their diet, with their multivitamins. This is the time I've never really been a proponent of multivitamins. I've always felt that this is something that the drug companies use to make money. But right now, I am advising everybody to be on a major multivitamin, one that has at least the zinc, selenium, magnesium, manganese, chromium that is needed. We don't eat enough of these things to make up. And of course, like I said, with increasing age, there is a diminishing immune status. So using multivitamins at this time is very, very needed. Encourage all the old people to get some form of daily exercise. And it's very important that they have mental health support. You know, they get a lot of laughter, they get people coming around them to chat with them, to play with them, as it were. Any questions?
We are going to take the questions when you are done. Hear me, ma?
No, you said again, you said we are going to take the questions when?
When you finish.
I finished.
Oh, thank you very much, ma. I was still writing down. Thank you very much for the wonderful lecture.
You did tell me 15 minutes. I tried to keep to that.
At least we have. Thank you for. So it's time about 3 questions for now, and we're going to do that in the next 5 minutes. So if you have a question, you can just speak up, or you raise up your hand.
I see 2 hands up, Dr. Oluwole.
Okay, let's hear from Mr. Amalchuku Ebozi. If that person is not ready, can we hear from Stephanie? Stephanie, can you ask your question?
Okay, thank you, Dr. Alero, and everyone for this webinar. I'm very glad to be here. I just wanted to know, like, Dr. Alero mentioned some vitamins and mineral that these elders could take. But looking at our situation, the economy and everything, most elders may not be able to afford this. Like, what exactly can be done to help them to live a better life, especially as the COVID pandemic is ravaging and we really need them to enjoy life to a long lasting period. So what can we do to actually get these supplements available, or is there any alternative item or minerals they can take to boost their immune system and all?
Yes, Stephanie, very quick. You are very correct. Now, the reason why we do ask that they should use the multivitamins is that most and generally they are unable to eat the amount of food that they need to have these minerals and vitamins provided naturally. You know, appetites are poorer, their ability to get a wide variety of fruits and vegetables, grains and pulses is less than was before. Many of them are actually not that expensive. You know, you don't have to do the big name ones. I don't even want to call any name. It's just to be sure that a wide variety of minerals and vitamins are included. Now, rather than take several tablets, it's usually easier to find them in one multivitamin capsule. And there are several available locally in Nigeria by our local pharma companies. Again, I'm not permitted to mention names, so I shall not do so. But they're actually cost effective, and the value it gives to the elder person, to their state of mind, to their well-being is incalculable. So it's worth going the extra mile to make sure that all the elders around us do have access to these multivitamins. Does that answer the question?
Yes, Ma. Thank you very much, Ma.
Thank you very much, Dr. Alero. We really appreciate. I don't think we have any more questions, but if you have any question, just put it on the chat and we are going to look at it as we move on. Thank you very much.
Sorry, I have a hands up.
Okay, you can ask your question, please.
All right. Alero, hi, this is Yomi Faturoti. I'm in the US. Thank you so much for this enlightening presentation. There's no doubt that we have a serious pandemic on our hands. But in your presentation, you had sepsis as one of the, like you had like a mental health outcome. I'm not too sure about that. Is sepsis a mental health outcome? If you look at your presentation, I don't know what
Yes.
number, what slide was.
I was trying to get back to that particular slide, and then
Yes.
I could. But basically, what I was saying is that the elderly already have challenges. We have challenges with them where it concerns their general mental health. They are more likely to be depressed. They are more likely to have other anxieties and mental health concerns. Sepsis and delirium. These are conditions in the elderly that are very often overlooked. And if we have a situation where the elderly is not being taken to hospital, the chances are that there's no trained health professional who can quickly pick up and say the reason why mama or papa is quiet or seems to be out of it, so to speak, could be an ongoing issue with either delirium and or with sepsis. Both treatable conditions, that being the point, that these are treatable, correctable conditions if we think about them and look for them and treat them. Now, when you have that going on, and then they are now exposed to this virus, they are all the more vulnerable to severe complications of COVID. And that's the point I was trying to make. So these are things that you see where if you have an elderly person in the house who is, say, God forbid, a known hypertensive or a known diabetic, and is going regularly to the clinic, then you are sure that there's a trained health professional who is taking a look at the person and saying, has he always been like this? Or have you noticed a change in behavior? Or, screening for sepsis. These are things that I know. I mean, I even had to deal with it with my dad. And, it was an issue where if we had not been thinking about it, we could have missed it. And this is 3 doctors in the house. So it has to be something that we're thinking about. I hope that answers the question.
Yes, it does. Actually, I had the same problem with my mom. But I just didn't think that, I thought sepsis was like a real illness. I didn't know that it was something that came through, that could come through delirium and all that.
No,
so thank you so much.
They can have sepsis and not even run a fever. That's the point. They can actually have sepsis and not even run a fever. So there's no clinical sign. And if you're not thinking about it, you don't look for it, you won't treat it.
Yeah, very true. Thank you so much.
Okay, thank you very much, Dr. Alero, for throwing more light on that. So we are going to take every other question at the end of the program. Thank you for the questions so far. So I'm going to invite Mrs. Titi to take the second and third poll for this program.
Thank you, Dr. Femi. So we're going to take our first 2 polls now. We couldn't do that earlier on. So we're going to run 2 polls back to back. So any minute from now, you should be seeing the first poll on your screen. And we kindly request that you make a selection with your answer and hit the submit button. So you should be able to see it now. The question says, what is your biggest concern about aging, either for you or your aged ones? So we have a few seconds left before we close that particular poll. Right, once we are ready, Joseph, kindly display the results on the screen. We're at 68% now. We give a few more seconds. I see about 36 people online. Please make a selection. We'd like to know what your thoughts are around this particular issue. Okay, we're closing the poll in 2 seconds. 78%. Okay, please display the results. Here we are. So we have an even split between the first 2 options, which is companionship and ongoing engagement, as well as access to regular and affordable health care. A few people have concerns, 15%, about care, either in-house, and then access to quality homes. Thank you very much. So the second poll, we're putting that up right now. Would like to also get your thoughts. in less than 1 minute so we can go back to the presentations. So now you should be able to see the second poll on your screen. Will you write a will? What are your thoughts? Please vote and hit the submit button. 20% and counting, 35%, another 30 seconds and we should be done. 68%. 80%. Another 10 seconds and we can close. We would like 100% actually. Okay, we're closing now. Thank you so much. Kindly display the results here. So we have 11% of the respondents saying no, 4% saying they need enlightenment to decide, 61% say yes, but they need help and enlightenment. 7% already have one, and 18% say yes, and they know exactly how to proceed. So thank you very much. Over to you, Dr. Femi.
Okay, thank you all for voting. And I think we've been learning so far. Without wasting much time, I would like to invite our second panelist. She's going to take us on the social impact of COVID-19 on the Nigerian elders. Our second speaker is Mrs. Iyom Josephine Aneni, Esquire, MNI and FNIL. She's the one-time Minister of Women Affairs and leading voice for women's rights in Nigeria and international advocate for the rights of older persons. She's also the founder of Alzheimer's Disease Foundation. Please let's welcome Mrs. Iyom.
So, and good morning to everybody, or good afternoon. Can I start? Okay. Good afternoon to everybody. I want to thank Dr. Roberts for a very lucid presentation. And she covered every area. So what I do, she has come from the medical aspect and maybe academic aspect. I'm coming practical position. I'm an elderly person, talked about and told you everything about. And so I've experienced COVID-19 as an elderly person. So I want to put my experience as an elderly. I'm even way ahead of the 60 years that is elderly person. Being that I'm 72, 73, so I'm real elderly. When I first heard of the coronavirus, it was coronavirus at first. It was so far away and it didn't mean much until we started hearing the news. And then of course, that elderly people are more vulnerable. 60 and above, you are more vulnerable to achieve. So fear was the first thing that I experienced. Before the president's lockdown, Abuja, Lagos, and Ogun State, and states started in lockdown, I advised myself President locked down, I think, on the 29th of March, but before then, it's precisely on the 12th of March, I started isolating. And from that 12th of March till today, as we speak, I've left my apartment. I've not left my place. I had fear. Then it got to loneliness because I excluded everybody. Of course, my children and their children are away, but all my family, I put them away in another part of the house and stayed on my own. Visitors, no going out, no visitors. Even the recreation club that we go for exercises, I stopped going from the 12th of March till now. I haven't. So after some time, I started feeling happy. You know, like when you're locked up, start feeling this, you're having malaria, you're having all that kind of thing. Cabin fever, loneliness. Then at the point, when is this thing going to end? Frustration. Then signs of depression, lethargy. In the morning, you don't feel like doing anything. Can go on for like days without getting out of bed, really, or looking for what to eat. And I had to pull myself back. You really need to pull yourself back because one can easily slide depression, and it will be a very serious matter. Remember, this elderly person is probably alone. I'm not talking people that have, living with families. Especially, I'm talking precisely for elderly people who are alone, who isolate themselves and be alone like I did. Then you find that sometimes you feel neglected. People are not calling. Keep calls. Then you call your children and say, I haven't heard you. Mom, but I called you 2 days ago. No, it's not enough. It's times a day before you now feel really loved and great. And Noah becoming paranoid because of COVID-19. And what is the reason for all this, really? It is the news on the internet, on WhatsApp, it's all this bad news, all these elderly people and they're going to die. Avoid elderly people. News alone can kill. And what did I do on my channels, news channels? I turn on music channel on DSTV. There's a music channel that plays all sorts of music, soul, church music, gospel music, any music. Turn on the music. Then if I want to see this, I go to African Laugh. So turn on the news channel so that you can learn about. There's COVID, okay, yes, there is COVID. There's nothing you can do about it. Cautions that I know that it's not going to come here. Then you hear sometimes, somebody was in isolation for 3 months and went out and got it. Oh my God, what do you do? You have to rev up your feet. What are the promises from God? You remember how the pestilence came to Egypt, but the children of God. So I'm a child of God. I'm of the Israeli song. So I will not die. So the faith, you have to be strong in your faith. Move closer to, if you have not been not religious, you have to be spiritual. And when it doesn't have to be Christian faith alone. There are some people who decide to be doing yoga or whatever. But I'm a Christian, so my faith is the Christian faith. And I go to it. And I remember all the promises of God. And the promises of God. And it says, you shall not die until he is ready for you. No pestilence, no COVID, no nothing can affect you. So faith helps you. It also helps you to deal with the, it also helps you to, sometimes you feel like a hypochondriac. All sorts of aches and pains and headaches, and, you imagine things, cough, you have to that these things don't exist in your life, and there is nothing absolutely. Exercise, then do something that you enjoy doing. I started farming. The patch behind my back became, right now, what gives me pleasure is harvesting my corn. I went to buy a coal pot. I'm roasting my corn. I'm eating. Pear tree, all that kind of thing. I want to cook. I go to take my vegetables. It gives you that sense of achievement, pleasure, and happiness. So anything that you can do to raise happiness will also raise your immunity and prevent you from having. But there is a fear, because I have a friend who also, I don't know how she manages this. She has caregivers. The caregivers just all left her. Her wahala was too much, that she can no longer go. So that is abandonment. So there is fear of that abandonment. Also are under stress. You imagine young people, you can't look after you, they are not supposed to go out, they don't have a life of their own. They are under extreme stress, and how they react, nobody knows. The effect is on the elder person. They can now resort to that elder person. A guy that told me that the woman's wahala is too much, from giving her a dirty slap or pushing her down or refusing to answer questions, or if she falls down, to help her or give her food when she needs it. And it's that fear of elder abuse, and abuse can also come, maybe the way you talk to the elderly person. I'm not experiencing that, so but I can imagine those living with other people can experience that from their children, paid caregivers, and all that. So the effect of this COVID-19, the elderly, is enormous. Is it about even financial situation? I don't go out, but I stopped house before the lockdown. But going to 4 months, things are running out. I need to go and buy things. And I call on the phone and I send money to him on his phone. Go and buy me this, that, and that. First, second, after some time, he can no longer get money from the phone bank. He has to use POS, and they are charging him 200 naira for every month that he changes. And what can I do about it? I know it's lying. It's part, it's part of the exploitation. I know it's like, and I just laugh about it. You just don't get upset. Make sure that you are in a happy mood. Everything turns to fun. See the bright side of life. And we will survive this. This too shall pass. And I'm happy when Dr. Roberts also told us that every person that gets COVID dies. In some places where they didn't know what to do, they died. But in Nigeria, we don't die like that. People walk out. So, yes, we may be vulnerable to COVID-19, but it's not a death sentence, and even if we get it, we will not die. But one thing again with the medication, all sorts of vitamins and all that, sometimes we don't even know what to do, whether it's getting too much or not. And not getting access to doctor, even my doctor, some, like when I told you I was all sorts of things, calling my doctor can be, I now realize that I was in a nuisance at that time. Because the doctor now started dodging. Doctor, I want to ask for what? I'm not in the clinic. What is wrong with you? Then I will remember so I sent the blood, the measurement, the readings. Blood pressure is good. I said, no, it's low. See, I'm not a doctor. How do my doctor is telling me my blood pressure is low, and I'm here telling myself it's low. I have to again, psych myself and tell myself, there's something wrong with your blood pressure. Continue with your medications and so on and so forth. So, it's fun being old. It will be brave, have faith, and nothing will happen. For those of us who are, would I say, a bit privileged, my heart goes up. My compatriots, my mates, my peers are not so privileged. The very poor ones. I'm worried about them. I'm worried about them because I don't see any response. I don't see anything that is in place them to look after them. Dr. Lero said we should take them. These things are very, very expensive. They cannot afford it. You said we should eat vegetables. Vegetables have become very expensive. Some of them don't even have food at all. What is being done? Medical, even if they have medical issues, they don't even have money to pay the doctor, So those are the ones that the heart goes out to, because our government has no plan, and I don't know how to look after them. You said their children, their families don't even have. Do you know that elderly people are still looking after 2 generations? They're looking after their children, they're looking after their grandchildren. And now with this COVID, they used to do to be able to cater for these 2 generations of offspring that they are looking after. Now they are locked in at home, they cannot do anything. The thing is dire, it is terrible. So that is the problem that we need to think about, solve. So a lot of people who will die, elderly people who will die at this time may not die from COVID-19. They die of neglect, they will die out of poverty, because of poverty. There is nothing for them. Wants to stop me. Is Dr. Femi wanting to stop me? No, not yet. Okay. So, okay, somebody has actually stopped me. Say time is up. Okay. Thank you. Bye-bye. Thank you.
Thank you very much, ma'am, for this your wonderful contribution and explanation. We really appreciate the personal experiences that you decided to use in your teaching, and I believe that a lot of us and the elderly ones amongst us can also relate to them. We also appreciate that you brought up the issue of elder neglect and also how the elderly people can handle some of the issues that they might be facing. Thank you so much, Ma. We are going to keep the questions that people might have for you for after the second, the third and fourth poll. Thank you so much, Ma. Then for our viewers on Facebook, we appreciate you. We can see your comments, and some of you asked for the link to this webinar. We actually shared it, but next time we are going to try as much as possible to make sure even our viewers on Facebook can get them. So I would like to invite Ms. Titi for the next session of the poll, that is the third and fourth poll.
Thank you, Dr. Femi. And thank you very much, Auntie Josephine. I mean, it was very touching for me personally to hear your personal experiences. And that's really what tells us that Dagomo, we are rightly positioned, because throughout this COVID period, we've been focusing on the elderly. And whenever we do distribution of relief materials, we focus on the elderly because we realize that they are caring for generations. And even if their younger ones were caring for them before COVID, the advent of COVID meant that they couldn't work like before. So they eventually, are very vulnerable. So thank you very much. I mean, we'll continue to do our best as Dagomo. And this brings us into the next two polls, because we're trying to get feedback to understand what are we doing well and what could we possibly improve on. Again, our role is that of a catalyst, and we're driving those values and care, in the elder care space. So any minute from now, you will see the third poll on your screen. Again, like before, we will run it just very briefly, stay for about under a minute. Yes, and you have it there on your screen now. What should the government do for older people? Is it to give food, rations, or give money, or give free healthcare services, or free transportation? What are your thoughts? Let us know. This will help us drive, what area we should be focusing on in terms of government interventions and policy. Please click your options and share with us, submit. Okay, we'll be closing this poll in another 30 seconds roughly. Would like as many people as possible to vote. We're at 73% now. Thank you very much. Please hit any of the options that resonate with you and submit your entries. We have about 10 seconds to go. 82% and counting. We do apologize that our viewers on Facebook will not be able to participate. We have to figure out how to work to incorporate that for future webinars. And thank you. 88%, and we're closing the poll now. Thank you very much, everyone. Can we see the results, please? And there you have it. 3% think the government should give food rations, 16% think the government should give money, and majority of us, 81%, think the government should focus on free health services. And this also aligns, I think, with what Dr. Alero told us earlier. Health services will include all those multivitamins and regular checkup. And I'm also happy to say that at Dagomo, we have what we do, which is a mobile clinic now. So we actually go house to house, to members of our elder community who are registered with us, checking on them. So the fourth and final poll will be on the screen anytime from now. Same as before. Please make a selection and hit submit. We will run that again for just about a minute. And there you have it. What do you consider an ideal retirement age? Nigeria currently, they say the elders are from 60 and above, but what are your thoughts about retirement? Dr. Alero did allude to the fact that the elderly still have a lot of value to give, and in some climes, they think otherwise. So what do you think? And we're bringing this poll to a close. Thank you very much, everyone. Can we see the results, please? And then we'll move quickly into the Q&A. So 17% think 60 as it exists today is good. 3% think it should be between 61 and 64. 31%, the majority think it should be 65. Another 7% think it should be between 66 and 69. 24% think 70, and 17% think above 70. Thank you very much, everyone. This brings the polls to a close, and I hand over back to Dr. Femi for the Q&A. Thank you once again.
Thank you very much to you guys for voting. This is really going to go a long way in helping, in guiding our decisions in Dagomo. So we are going straight to the question and answer session. So if you have any question on the topic that has been discussed, you can either raise your hand or you just type the question and we will invite our panelists to answer your questions. So just raise up your hand or you just type your question. Rose, are you still there? You raised up your hand some minutes ago. You wanted to ask a question. Can you go ahead to ask your question now? Okay, everyone is just thanking our panelists for the seminar and for the webinar. They are appreciating Mrs. Aneni and Dr. Alero. Okay, somebody said, thank you, Mrs. Iyom. I now understand what my parents are going through. That is Idioma. Do we have any question from anybody? Okay, I think our panelists did justice to both topics. So if we don't have any question, I will give us 1 more minute before I invite Mr. Dan to take the closing remark.
Dr. Femi, there was a comment from Idowu Jurojaye in the comment box. And Idowu said something about, my take is that, why can't government give private hospitals the opportunity to carry out checks on individuals? I feel this will hasten the checks on whoever would be a victim and nip the virus in the bud, rather than the slow pace they are going on in checking people. So maybe Dr. Alero would want to speak to that.
Exactly.
Thank you. I had actually answered him privately because this is something that, of course, has been asked over and over and over again right from the very beginning. There are 2 main issues. One, we need the data. And it's very difficult when you start giving private clinics. We have proven it over the course of the last 60 years. Private facilities do not return data to the government databases. So we have no idea on how many people are being tested, who has it, who doesn't have it. And these numbers are vital if we're to make a case. For instance, when we now start wanting vaccine, if our numbers are low, we'll be at the back of the queue. And we will not have the true picture of the numbers if we allow all sorts of private centers to start testing. So we have to have some kind of control over the testers, the centers that are testing. But even more importantly, as has been shown, is this issue of charlatans. You now allow private centers to test. We haven't got the manpower to ensure that they meet up to standard. So they end up now deceiving the Nigerian populace, telling people are negative when they are positive, telling people they are positive when they are negative, collecting all kinds of spurious fees. It is an issue. It is already an issue. We've seen it in trying to eradicate polio. We saw it in trying to handle the HIV. When it's just an issue. So unfortunately, we just don't have the manpower, the little manpower that we have in terms of pharma and agencies such as that. It's easier to just say, you know what, no private clinic or hospital is allowed to test. So that if anybody now says they've done a test elsewhere or whatnot and a report is made, that facility will just be shut down. The risk, unfortunately, that's the kind of people that we are. You need to always just wield the big stick. I hope that answers your questions.
Thank you very much, Dr. Alero. So I think the next question should be for Mrs. Eon. The question is from Stephanie. She said, talking about care homes, there is not much acceptance of this in these parts. What can we do to bring this to light? That is elder care home.
Please, I didn't hear you well. Hello?
That there's no much. Okay, Stephanie is asking about, yes ma'am, can you hear me? Stephanie is talking about elder care homes, that there's not much acceptance of elder care homes. What can we do to bring this to light in our setting?
I have been advocating for elder care, met with a sort of a brick wall, and people are saying that it's an abomination, it is not our culture. But I've also is that need, when they need it, they will throw away culture. Because let us be honest to ourselves. Most people are busy raising up their own families. And when you can just, call your relatives from the village to come and stay with you. Nobody does that now. You can hardly get relations to come and stay with you. And we also have the law in Nigeria about child that. So you cannot have children in your house, and you're training them and you're sending them to school and they're not giving you the service. So you don't need them. When you are alone and you find you yourself will start looking for an elder care home. Go and spend your life, the rest of your life, peacefully. And there are people, professionals, trained people to look after all this. So we find abroad that people actually they sell up their homes when their children have left the nest, sell up their homes and buy a retirement village. There's nothing, because you have to be practical. The children, and you cannot be all alone. You need care. You need somebody to look at you. And then as you get older, when some people lose, when they cannot do things for themselves, imagine an elderly person lost functionality. How do you keep that person alone in their house? An elderly person who has lost their cognitive ability, and you now say that, how do you leave them at home? Would you, as a child, because of culture, live in Abuja or Lagos and come and stay with your mom? The answer is, then you think you can now get a house girl, or not a medical person, to look after your mother or your father who has dementia. It won't work. They will kill the person before death. And then you come and do a fantastic burial. Use that money to pay a. We have them all. We have them everywhere in Lagos. We have in Benin. We have in Abuja. There's one beautiful one in Abuja. I will advertise that here now. GSCC homes in Kuba. I think it's in somewhere in Kado, somewhere in not in Abuja somewhere. GSCC. If you Google it, you will see. It is the abroad. You go and pay. And you know that there are doctors, there are health officials who will look after your mom if they need that. If they can still stay a beautiful environment, enjoy their gardening, enjoy their tea, and also make new friends, make new old friends. If they are widowed, widow meet widow, they jam together, they live life. What are you people talking about tradition? We have to change our mentality. And that is the new norm that will come. We must have for our elderly people.
Thank you very much, Ma, for helping us out with that question. Thank you very much. Retirement village, I wrote that down. I'm going to read about it later. So we have another question. I will leave the question open for either Dr. Alero or Mrs. Eo. The question says, talking about retirement age, I think it should be left open to individuals to decide, because most times these people still have a lot to offer. How can we influence the government to leave the option open?
I'm going to defer to Mrs. Aneni on this because I think it is Mrs. Aneni, I'd say I agree with you wholeheartedly that retirement homes and assisted living for the elderly. I mean, it's something we just have to consider because people forget that the structure of society has changed. You know, the multi-generational units which we had in the previous decades are actually no longer functioning. I mean, for a lot of elderly people who have children abroad, for instance, and the children abroad want to ensure that their parents are properly looked after, it only makes sense to put them into assisted living and have on tap the professionals that you are talking about. So I think a comment from you about the retirement age would be very nice.
Thank you, ma'am. Okay, so that question I just read was from Benjamin Michael. So the next one is more of a comment. Say, I really enjoyed this seminar. Please, could we have more like this? But now for we the parents and how we can handle our kids going back to school soon, because that's my fear. So somebody's trying to talk to us about our fears concerning our children that are going back to school soon. I don't know if our panelists can give any comments on that. Okay, what we have here is, okay, you can go on, ma. You can go on, ma, Mrs. Theo.
Yeah, I saw one here by Oluwa Yomi Ifaturoti. After their parents and both died at the ages of 91 and 92. The price children need to pay rather than throwing their parents into. That is the mentality I want us to change. You are not throwing your parents because the homes are not cheap. You know, we have the older people's homes where they used to put destitutes. So that picture of many people, they think it's where you just dump this don't go back there. Assisted living, retirement, and all that, they are not cheap. So when you are working abroad or wherever, you pay good money for your parents to get good looking. Of course, you can always visit them, and you should always visit them where, but it gives you, liberty to face your life. Friends, you are looking after them, you're paying your responsibility to them, but you're also living and raising up your children. It would be unfair to expect my children to abandon what come and live here with me. I will not do it. I would appreciate it when I function on my own. Pay for a very expensive home where I go enjoy my life like we do.
Thank you very much, Ma. I think we can see the impact of our webinar here. Somebody said, that is Gloria Ejeki. She said, thank you to all the speakers and the organizers for a lovely session. My mom turns 77 today. I'll be sure to bombard her with calls. Every little helps. Happy birthday to your mom, Gloria. Okay. Thank you very much. to our panelists and to our audience. We really appreciate your presence here. Without wasting much time, I would like to invite Mr. Dan for a closing remark.
Hello, can we still ask a question?
Okay, we'll take that as the last question.
Okay, it's not really a question, but I want to thank Professor Anini for what she said about my comment. But you know, I don't think we have all agreed on the way to go forward. In Nigeria, I know that there are very expensive assisted living homes right now being set up. And I know that the children, I mean, like she said, I wouldn't want my children to also have that responsibility when I cannot do anything for myself. But I'm just saying that even here in the US where I stay, it's been found out that a lot of the elderly would like to stay in their homes rather than going to be in an assisted living home because of the, they are used to the place and all that. So to make them happy, what is being done most of the time now is taking care of the people in their own homes, not necessarily in another home. So going forward, I think it's something that we should really look at for Nigeria. What is the best way forward for the elderly? Whether they are poor, they are rich, what is the best way forward for the elderly? It's something that I think the government has to look at, because definitely we are all, aging more gracefully and we are all getting older. So we need to find a way where the elderly can be kept happy and, they can have a successful life, in their latter years. So I just think that it's food for thought for the organizers, or maybe something that we can write a paper about and pass it on to the government for them to start looking at. So thank you very much, Ma, for that comment. God bless you.
Thank you very much for that comment also. Well, the Agomo Foundation is actually working with the Edo State government in that light. We are working on an elder care policy on how to, it will cover all these aspects that we've been talking about. And we hope that very soon the policy will be passed into law. Thank you very much. So, Mr. Dan.
Good afternoon, everybody. I want to just, my work here is very simple, to thank you for attending. So I want to first thank our Executive Director, Mrs. Ifweko Moigwe-Okaro, who joined us initially. I want to especially thank our panelists. Dr. Alero, thank you very much for your very succinct presentation. And also, Iyom Josephine Aneni, thank you for your very practical, more or less life story you have shared with us. I mean, it's not something we can pay for at any point in time. I really want to thank you. Thank you, our moderator, Dr. Femi. Thank you, our Chief Program Officer, for the polls. I hope you all enjoyed the polls. I think I personally enjoyed that too. Thank you for all of you who viewed on Facebook and those of you who joined in from different parts of the world. Thank you very much. We appreciate you. We'd like you to keep following what we do in Dagomo, www.dagomo.com, our Facebook handles, and our other Instagram and social media platforms. Again, thank you very much. We look forward to doing more of this with you all. Thank you. God bless you. Have a great day and stay safe.